I have to just bite the bullet with this testosterone because I know that it could be a real game changer.
Even our most baseline panels still coming equipped with 40 biomarkers. So we can make a really good deep dive into your health by looking at a ton of different biomarkers, asking the right questions, and that just puts you on a warpath to just get healthier.
40% of people have that MTHFR gene mutation. Yeah. So it's harder for them to metabolize some of those supplements. So if you give them the methylated version, then it's better for them to be able to actually use it.
Precise supplementation is extremely powerful. Labs are the foundation to creating a healthier life. It's just such a great deep dive into your health at what's going on at that time.
So Josh and Katie, just like Madonna, are on the podcast today, and they are the founders of Blokes and Joi. Now, here what we said before the podcast, is it called Blokes and Joi, Joi and Blokes? I know you guys are going to be merging companies. What do you call yourselves?
We're two brands.
Okay.
And Blokes is obviously oriented towards men, and then Joi is oriented towards females. And we're going to have one URL, two social handles, just because we want to speak directly to the male and female consumer.
Perfect. Okay, that's a great way to kind of just make it very concise. So before we get into what you guys actually do, we're going to do a healthy shot. Like you said, it's like the Andy Cohen, but the healthy version. And these are called Magic Minds. And what this is great for is focus and productivity and just getting your mind like focused and like turned on. So we do a healthy shot here with everybody that we do live. So we do like a little cheers. Yep. Cheers to you, Josh, and to you.
And to you.
And just down the hatchet. I've had so many of these today.
That's good.
It's good, right?
Yeah, it's really good.
And I sound like a broken record, but I love the ingredients. And it really does just kind of like focus my attention. And I love the ingredients, like I said. So that's what we do here on Habits and Hustle. We get primed before we get into the nitty gritty.
Yep, let's do it.
Yeah, and since you guys are also health and wellness fanatics like me, we'll have a lot to talk about today.
Let's do it.
All right, so this is why I'm having Katie and Josh on the podcast, because I have been using the company for a short time, only a short time. But what they do is basically they come to your house, not them personally, but they have a nurse or a phlebotomist come take your blood. And what they do is they take a very close analysis of 80 biomarkers, correct? 80 biomarkers. Mm-hmm. And they give you afterwards a very personalized and proactive approach to your health and your wellness in everything from women's health, like hormones, peptides, anything longevity. And I love you guys. I think you guys are like super down to earth, super cool. I love your company. And I wanted people to know who you are, and I wanted to hear your story, and that's why you're here. So thank you for being here.
Thank you so much.
Thank you for having us.
Yeah, you're welcome.
Yeah.
And now that we had the shot and we're like super, focused, Josh, why don't you start by explaining, because you're not a medical doctor, nor are you, Katie.
Right.
Explain why you even started going down the path of personalized medicine and why you even did Blokes and Joi in the first place.
Yeah, I'll back up a little just to provide some context, but I've been in healthcare for 16 years, worked for a large medical device company called Stryker for about 5 of those years. I was a spine rep. And then I left Stryker and I became an entrepreneur in healthcare. So this is my sweet spot. And then right before we started Blokes and Joi, we had owned regenerative medicine clinics, i.e. stem cell clinics. And those were doing really well. And then something happened, which was COVID, and it changed the world, and it changed our business dynamic completely. We shut down for a solid probably 90 days, and then we slowly ramped back up. But during that process, it was a big come to Jesus moment for me, because Katie had told me not once, not twice, probably 100 different times that she was going to divorce me. So
True.
That was really the start of Blokes and Joi.
Wow.
Well, Blokes first.
Wait, not to be like a marriage therapist, but what exactly,
Sure.
Why were you going to divorce Josh?
When I married Josh, I was 35, and so my focus was to start a family.
Right.
And as we know, as I think we talked about, when you're 35, it's a geriatric pregnancy. So you need to go. And right at that time he was having issues. He had zero sex drive, like none. I would try everything that I could think of to get him interested, and he just wasn't. And ultimately, I was thinking, it's me? Like, I've gained weight since we got married. I'm like, what's going on? And of course, I like blame myself. But that's the start of it. And we, figured out what it was finally. But it took him a while and was way too hard to figure out. So.
Yeah.
Wow. Okay.
I had no sex drive. I had no idea why. I also gained,
and how old were you at this point?
I was in my early 30s at this point, and there's some pretty big events that happened in this time frame, but I was also just like a grinder when it came to work. I've lived a high stress, high income type jobs where it was just constantly moving. I was taking doctors out all the time. So I was drinking lots of wine, eating lots of steaks, big meals, and I let my body go. And that didn't help anything. I was 50 pounds heavier than what I am now. And my blood pressure was through the roof. My waist circumference was, in the 40s. So I was like the classic definition of metabolically unhealthy at that time. And coming from being an athlete, I played rugby at a high level. It didn't feel right, but it happened on such a slow period of time that I just kind of just let it fall to the wayside. And it took me a while to realize, almost like an alcoholic to some extent, it took me a while to realize, like, yeah, I don't have a sex drive. I haven't seen the inside of a gym in ages. I don't even care to. The only thing I can do is drink a shit ton of coffee to get through the day and just grind it out. And COVID was the first thing in a decade that slowed me down. That told me all that exterior stress that I was experiencing went away. Like, I didn't have a business. Like, it was there, but there was nothing happening. I'm like, holy shit, my life feels pretty good. Like, I actually want to go work out. I want to go do this. But at that time, the problem was too big and I needed to get help. And she was ultimately the catalyst that said, dude, go get some help or I'm going to divorce you. I mean, we were on the rocks, and we have two beautiful kids. And the thing that we talk about is we also went through 4 miscarriages, and Katie can dive into that. And it's something that I'm so passionate about as a man, and because you're rarely told as the woman's going through that process that you're changing with it. And I mean, the first pregnancy, we ate all kinds of burgers. I got fat. I never lost it. Got fatter again. And
you got fat.
It was.
It's funny. Like I hear that all the time, right? Like, it's not just the woman. You're also like, you're not even pregnant, but you're gaining all the weight, right? Because
And it's not just the saying. There's physical changes that are happening that are keeping up with your partner. Hormonal changes, in particular, testosterone, estrogen, progesterone. There's even studies that show that prolactin in men change. But the testosterone,
really?
Oh, you bet. And
while the woman is pregnant?
Totally.
What study is this? And what do they say exactly?
I don't know the exact study, but the study is that the prolactin, the little bit of data is that prolactin increases so the dad can be more alert. Which is interesting, but testosterone levels drop.
Right.
Estrogen levels go up. And anytime that combo is happening, and stress, cortisol, your stress is going up. For me, I was scared as hell to be a dad. I really was. We joke and we laugh that I played the Phil Collins song One More Night.
Yeah.
Because I just wanted one more night by ourselves, you know?
Yes.
And so, like, I was a mental midget when it came to it. And then it ended up happening.
I love that expression.
It was the
I do
best
too,
thing.
and bravo for admitting it. Thank you.
I was. But
hold on, my friend who's going to be here later, his saying is, the tallest midget in the room is another expression. I love.
I'm gonna use that one.
A mental. Okay, sorry, that's amazing. Okay, go on.
So I did not really think through that, and I also let my body go. But ultimately, to wrap it up, I went and saw multiple physicians. Internal med docs. I reached out to the doctors I knew because I have Rolodex of doctors, physicians, surgeons, and really the consensus was there's nothing wrong. You're normal. Go back home and lose 10 pounds. That was really maybe the gist of it. checked my blood. Testosterone levels were looked at, weren't even really brought into the equation. Now
But they did check them.
they did, but at that time I'm in my mid 30s, and
What was your levels?
low 200s, which is literally the definition of hypogonadism, which is the true definition of low testosterone.
Right. For a man, for sure,
Oh,
right?
for a mid 30-year-old man, I should have been 700, 800, 900, maybe higher. But the reality was nobody addressed it. And I literally, just sheer luck, I threw up kind of a Hail Mary to my brother-in-law and my sister. I said, here's what's happening. Here's what's going on in our life. I'm a piece of shit. Like that's ultimately what I came to.
Well,
And I was told I was normal. And I was fortunate that I went and saw a guy. It was extremely inconvenient, but he got me on the right track. And that physical change happened. My mental fortitude changed, my mental drive changed, my physical ability changed. I felt different. I had a sex drive, which she was like, Jesus, chill out,
Really?
Yeah, totally.
How long did it take to kind of get back to a
30 days to start
baseline?
feeling the changes. 30 days.
30 days, okay.
But probably 6 months before I was like, wow, I'm in the zone. But within that 30 days, the entrepreneur in me said, holy shit, if this is happening to me, a guy who's been in healthcare for 16 years, at that time 13 years, how many other people is this happening to?
Right.
I was gaslit. How many other people are being gaslit? We now know, because we've been in this almost 3 years, there's a whole gaggle of people being gaslit. Our country is metabolically unhealthy. And we are suffering, and we are suffering from a preventative and proactive care standpoint, and that's all we've become.
So that's interesting to me, because I do feel like there's been a real spike in overall personalized medicine. A lot of companies are coming to the surface now who probably have kind of noticed the same things with preventative care, and I guess regular MDs, they're not concerned so much, I feel, with the testosterone, overall hormone levels. Even when I go, and my testosterone is at literally almost zero probably, and they're like, no, it's fine, you're a woman, it doesn't matter, you don't need it. And they don't even, it's very overlooked. And as a man, I'm surprised though, because I guess it happens with men as well when you go to the doctor. But so your regular doctor is basically just go home and lose weight. And then this other doctor, from what you're saying, is he the one who puts you on was it a shot of testosterone? What did he give you? Was it a cream? Was it a pellet?
It was a cream.
Okay.
And this is just my experience. This is not universal, but I did not do extremely well with the cream. I just felt it to be kind of a pain and a mess. And I was like, dude, I'm leaving you. And then he prescribed me an injection. So I switched to injections, and that was when things just clicked and started happening really quickly for me. And
what number were you at then? We went from 200
well, I can tell you, I just got my labs done. I'm at 1100 right now.
1100?
Yeah.
That is high.
Well, now our optimal range for men is 800 to 1200 nanograms per deciliter.
Okay.
You're going to fluctuate. And we do subcutaneous injections on most men. That's not always, but we do that mostly. And we do it biweekly, so twice a week. And your levels are going to be somewhere between, my levels probably within a week are 800 to 1200 on any given day.
Wow. So what's the difference between when you were at 200 versus what you were at 1100? What are the physical, mental traits that you have now?
I mean, I literally say it's like comparing a Ford Fiesta to a Ferrari. My body and my mind are all of a sudden clicking. I all of a sudden am in the driver's seat of a high performance machine. I've never had a bigger appetite to work out. I've never had a bigger appetite to prioritize my health, mental health and physical health. I've never had more patience with my children, my wife. Oh God, yeah. It gives you this edge to just want to live healthier and better. And you could do exactly what I do and not make those changes, but it gave me a cheat code to start making those changes and habit stacking with everything I've done. I've lost that 50 pounds. I've gotten stronger. Everything about my life has improved. And the beautiful thing is we started this company selfishly for ourselves, but then we started changing and seeing so many other people we're impacting. And it's just like a broken record. We are improving almost every life we touch.
That's incredible. So then, okay, you were talking about how you initially were in the stem cell space. That's no longer, because stem cells. We were talking about this earlier. Are they illegal now in the U.S. more or less, or you have to be like? What is the protocol and what's the FDA? What is the current situation in the U.S. for stem cells? Is that?
Yeah. So there's a whole big novel of guidelines to biologics, and regenerative medicine stem cells fall under that.
Okay.
Where the line was drawn in the sand is umbilical cord tissue, umbilical cord blood, even though it's FDA approved for cancer, but it's really the lack of research that's in that.
Okay.
So anything that's coming from a scheduled C-section, which was happening, and I do believe in that side of the business, is really it's if it's happening, it's gray or off limits area. But what it's done is it's create this vacuum for offshore clinics to basically take MSCs, mesenchymal stem cells, culture them, grow them, expand them, and then throw them back in patients from a young umbilical cord. So you can still do autologous, which we talked about.
Yeah.
It's coming from yourself. So bone marrow, fat, PRP, all that you can do right now in the United States with no problem. You can probably find a clinic within 5 miles from here offering it.
Wow, but you're not
No.
in your current situation. You're not doing any of those anymore.
No, I mean we're virtual, so we're licensed in all 50 states, and to be frank, I like this side of the business because as sexy as stem cells sound, we are treating a much different demographic.
Yeah.
Our sweet spot was 65, 67 years old, and
Really?
you're treating a lot of people who suffer from osteoarthritis, knees, hips, joints, and there's nothing wrong with that. But I love being on the preventative and proactive side of care. I think we can prevent people from going down that unhealthy route, that total sick care cycle.
That's what I was going to ask you. So, because let's just finish with your personal story. So then you went on testosterone. What other things have you done to help with your health? Like, what else are you on right now?
Yeah,
it started with testosterone, and you're still on it.
Yeah,
right? Okay.
I'm a guinea pig for everything that we do, and I
Okay.
love that. There's not a peptide I haven't tried. There's not, there's everything that has been out in the market. I've tried it. Right now, I'm on a growth hormone secretagogue, so
What's it called?
Somorelin.
Somorelin, yes.
Yeah,
That's a peptide.
Yeah,
That's a peptide.
and it's great for anti-aging. It's great for muscle. It's great for energy. It's great for sleep. I take NAD. I take a nasal spray. I take an injection of it. There's gut healing peptides that I take from time to time, and that's really kind of my sweet spot, and obviously TRT. And then I just dabble with things from time to time, like glutathione, B12, anything that is going to give me a lift in life. I'm open to it.
Well, I'm just very like the peptides for me. I'm very curious about them because it's literally a 50-50 split. I have people who, a lot of my friends, people who really believe that they've done wonders for them. Other people don't feel them at all. Some say that if you're prone to, like, if your cancer runs in your family, taking some Morlin or any of these things can be actually harmful or dangerous. Like, what is your take on all that stuff?
I forgot about one peptide.
Yeah, go
I
ahead.
do take tirzepatide. So it's
Is that a peptide though?
It is a peptide.
It is,
It's a
yeah.
glucagon-like peptide, GIP. So it's
GLP-1, yeah.
it's in the peptide family.
It's in the peptide family.
Oh, you
so
bet.
just so you know,
100%.
GLP-1 is like the weight loss drug that's Ozempic. What he's talking about, what is it called again?
So tirzepatide,
Tirzepatide.
yeah,
It
it's a
works on
compounded version
Yeah.
of two FDA-approved drugs, Mounjaro and Zepbound, and it's for me, it's been an absolute game changer.
For how? How has it been a game changer?
Well, I was a lot fatter, if you remember.
Right, 50 pounds fatter,
50 pounds,
actually,
50
yeah.
pounds heavier. And it's given me the food freedom that I never had. And, well, I didn't have for a long time. But there's so many other things that came with that. My BMI is down. My waist size went from 40 to now I'm a 36. My blood pressure went from, pretty high to in a very optimized state. The other thing, when I started this company, my A1C levels were on paper, they were diabetic. I just got my blood done before I came here and I got the results just a couple days ago. My A1C is like in a almost a perfect position. So like so many things have improved with that.
That's so interesting. I didn't realize that the GLP-1 was considered a peptide because I just put it under the category umbrella of like, of a weight loss drug. But I mean, and we're going to get to you, Katie, in one second with the women's side because I have a hell of a lot of questions. But what I'm interested in, when you're doing so many things, right? When you're doing the testosterone, when you're doing all these peptides, how do you know which is working on what, right? Like that's the problem. Are you starting with one to see how far you get and then you're adding? How are you knowing what is working, what is not, if you're doing so many things at once?
Yeah, I've been at it a long time.
Yeah.
So my body is in a very optimal state of testosterone. So I know how my body feels from that. I know how my body reacts and feels from Somorelin. Some of these can
start. I'm not to interrupt you, but I just want to make sure it's clear. So when did you go and so how long were you on testosterone before you incorporated Somorelin or incorporated trizepatide?
Right away.
Right away.
So what I was going to say is some of these can be antagonists and some of them can work synergistically. We would never try to put somebody on two different growth hormones because you're not going to know the difference.
Right.
But the rule of thumb I have is like hormones are the foundation of your house. You got to have a healthy, base to then add on to that. I got my levels pretty dialed in pretty quickly. And then I could start adding on and, putting in the fixtures and putting, all the nice things that I think peptides can do. But I also had just a weight issue that I needed to address pretty quickly.
Yeah.
And that getting my weight in line, I think inversely helped everything else too.
Yeah. It's also, okay, so, because that one that you were saying, the trizepatide, since it's a peptide, it works on, just so people understand, it works on two separate receptors, basically.
Yep.
So Ozempic and that GLP-1 works on one receptor.
Correct.
The trizepatide works on two receptors, right? So technically, is it just way more effective than semaglutide, which is the...
Yeah, it's I don't know if it's way more is the right word, and honestly, it's different for everybody. We'll have some people that'll switch and say, actually, I liked the semaglutide better. So it really depends, and you might have to try both. But the studies show that the tirzepatide is up to 20% weight loss in a certain amount of time, where the semaglutide is 14 to 15% weight loss. So there is a little bit more effectiveness there. But the biggest thing with tirzepatide is that there's less side effects, which is a big deal. Less nausea, less, acid reflux, that kind of stuff.
So yeah, just before you were on, I had Max Lugavere here, and he was telling me someone in his family, we talked about this on the podcast, is on the semaglutide. And yes, they've lost like 15 pounds in 2 months, but they're like so exhausted that they literally can't get up. They're like, it's like the worst like side effect. So like, yeah, you might be thinner, but if you have like a bad quality of life, it's not that great, right? So like, I think you and I were talking about this a little bit last night even, Katie, but I was told, not by Max, this is now not about Max, but like Dr. Mary, what was that woman? Dr.
Mary Claire Haver.
Mary Claire Haver. She was telling me on the podcast that women who are now on hormones, when they add a semaglutide or a GLP-1 drug or peptide, they're losing up to 30% belly fat now.
It's 30% more effective.
Yeah, 30% more effective.
I think I saw that study that she posted as well. For sure. And it makes sense. I mean, because when we think of hormones, they're like the foundation. So there's nothing that's going to, if you don't have hormones or if your hormones are declining like they do in perimenopause and menopause, there's no like supplement, lifestyle change, magic pill that will do what your hormones do. So your hormones are just an important part of everyday life and function and vitality. So it makes sense that, they work together. And part of the reason, honestly, is especially if you add in testosterone is that you're able to build and maintain more lean muscle mass, which we know is so important for losing weight and doing it the right way and being able to keep it off. So if you combine those things and do the right dosing, like we talked about this, go lower and slower, you're not trying to like the point is not to starve yourself and eat. You still need to eat, 3 meals a day. So if there's something going on where you're like, I don't feel like eating, you're taking too high of a dose.
Too much, right? And
The thing that it to me it's designed to do is to create better habits.
so this is the thing, though, right? I think what's happened is a lot of times people are not doing it for the right. They're jumping right into taking it. They're not using it as a last resort, and so they're not learning behavioral change. So they're not learning these new habits, and they're not incorporating the diet, the exercise. They're just taking the drug and then losing weight, and then not really like they're not adopting all the other things.
Yeah.
I think it's a different story when you're doing all the right things and then you add this up to supplement what you're doing already. It's a whole different ball game, right?
Yeah.
But what I was going to say, because I want to ask you about all the hormones, and I find it interesting because women, no matter like there's been such a fear factor in women getting on testosterone, right? Because they feel like nervous that they're going to gain weight, that they're going to bloat. I'm one of those women, by the way. I'm not just talking for a friend. I'm talking for myself, because of all these like things I've heard for so many years. Right? I'm going to grow facial hair. I'm going to have rage. I'm going to do this, and it's always been like a male-driven hormone that we think it is, even with all the research and studies coming out that it's actually not necessarily true. Are you on testosterone?
I am. It's one of the first things that I did on my journey.
You did, and it made a big difference, right?
Huge difference.
So this is interesting because I have a lot of people a lot of friends I know who it changed their life. It gave them energy. It gave them it helped them with lean muscle mass. It helped them with all the things that you don't even know that you're really lacking.
Brain fog, inflammation.
Right. All these things that, I mean, I hate to say it, but like when you're in your 40s, like these things start to like very quickly decline.
Yeah.
Right. Not quickly. I should say that's not true. Slowly decline, that you don't even know that it's happening. So that's what that's what tricks your brain. You're like, it can't be that. It must be that I'm just like super tired, or I'm overworked, or it's my kids, or you don't know what's wrong. And so it's always the last thing that people check, or they go to the doctor.
Yeah.
And they're like, oh, you're fine. Even though you have a 10 testosterone, you're fine.
Well, it's normal.
It's normal. It's normal.
Yep.
So why is that? Why do they, your hat, fuck normal. Why are doctors not comfortable, or why do they not address or attack this hormone problem like regular MDs? I don't understand it.
I'll tell you why.
Okay, tell me.
They're not trained that way. I will tell you that only 1 in 5 OBGYNs are trained in menopause care. So 4 out of 5 women will go to their OBGYN and be told they're fine, they're normal. They get gaslit. They say, I want to check my hormones. I mean, I literally hear this every day from women who say, I want to know this or that number, and they get denied, whether it's because insurance doesn't cover it or the doctor doesn't think it's necessary. They're denied this information and told, maybe they're not listened to. We don't feel listened to. And it's not because the doctor is bad or they don't care. It's literally because that's not how they're trained. There's no menopause care in OBGYN. And so this makes me so angry because even though there's a movement, which I think is fantastic for women in menopause right now, we know
even perimenopause, right?
Yes.
Same category.
Same category, yeah.
Like we're getting more loud about it, which is fantastic. We know that we don't have to suffer in silence anymore. We know that there are options. And I feel like we're at the beginning of it, but I still feel like we're doing a lot of it wrong, because I see women every day that are coming to us fearful and they're confused.
Yeah.
Because there's just not enough information out there, and there are experts in the space who are very well credentialed and who know a lot and who treat people, and they're saying different things.
Yeah.
And they're saying things that are confusing and scaring women. And so one thing that I would like to see changed is how we approach this. Like you've mentioned several times that you're scared of the testosterone. And, fear is just a lack of information.
Yeah.
So really what we need to do is educate women in a way that's not scary, in a way that's not confusing. And we need to realize that there's not just one way to do things, because this is like my main point that I hear all the time is all these conflicting statements from
Yeah.
people. Like one example I'll give you is, no one should do hormone pellet therapy.
Yeah. I think I'm the one who was actually, I've heard a lot of most people I know, I've had a few friends who are on them and they really like them. It's worked for them. Majority of people I know don't like them because they over testosterone you. They give you too much. So they're not like, so if you do have too much, there's no way to back it out. It's stuck in your body for what, 3 months or 4 months?
Yeah.
Exactly.
So you can't control the amount. So that's, and then people have way too much in them. That's the problem.
But I totally agree with that statement.
Right.
We don't do pellets and we don't recommend them. And if someone comes to me and says, like, what should I do? I would say, here are all your options. And I'd say the pros and cons of each. But what I don't like is that we're scaring women and saying, this is, you can never do this. Because the thing is, it does work for some women. I have a really good friend that I work with, and she will tell you that it saved her life.
Yeah.
So like,
I have a really great friend also who's like, thinks it's the best thing that's ever happened to her.
So I don't like that we're shaming those women or we're scaring women into going like, if I do this, then what's going to happen? I think women are smart. We're smart consumers. I think we should know what all the options are, and then you choose what's right for you. And I wouldn't recommend pellets, but I also think like the way we're shaming and scaring women is honestly just scaring them away from getting help and treatment.
True, but I will say there's a lot of people who are just like are money grabbing, and a pellet is, let's say, $600, $700, and it's a very easy thing you can churn out. Like I know doctors who are like, they're like a functional medicine doctor, and they're like churning and burning. They're come in here, I'll give you a pellet. Next up is like a cattle call, and he's putting in like 50 of these things in a day without giving people options. Or a lot of times, like people, you got to say to like me or a consumer, like if I don't know any better, and my doctor is telling me to go get or do a pellet, and I don't know that there's a different option, such as a cream or the, what do you call it, or the injection, and he's only telling me about a pellet, and then I do it and it's way too much testosterone, then I'm going to be like really sick and unhappy, right?
Yes. Okay, I am so glad you brought this up.
Right.
Because this is my other point of what I think we're scaring women on. I've heard that a lot. Pellets are expensive and it's just a money grab. And I'm not arguing, I don't know, I'm sure they do make a lot of money on that. They are trained, like the pellet makers literally came out and said, we're going to train these people to do this. And, this is the retail price and this is what they make. So yes, they are making money on that. But I still think that's like a freaking scare tactic to say, don't do this because they're just making money on it.
True.
Here's my real hot take on this, if I can just get on my soapbox.
Yeah, go ahead.
Everybody is making money.
Yeah.
If you're a doctor selling supplements, you're going to make money. If you're a doctor seeing patients, you're going to make money. If you're a hospital, a clinic, you need to make money. We need to make money to pay the bills and keep the lights
100%.
on. If you're a speaker or an influencer, you need to make money. So I feel like level the playing field on like who's making money because we all need to.
True. But the thing is, like, I guess my issue is when people come in without any information and they have no knowledge, and someone says to you, this is the only way to do it.
Yes.
That's a problem.
That is a huge problem.
Yeah.
That's what I'm saying. We need to educate women to say there's a lot of options.
Right. Here's one option. Here's two options. Here's three. And I think if someone's a beginner, I think it's very irresponsible to go from 0 to 60 and put somebody on a pellet.
Yeah.
If they've never done it before and they're like nervous and scared, then you're going to like shoot them up with 300, whatever cc's, whatever they're measured in. Like maybe like go slow and see how they react and respond. So like to me, there's a lot of quacks out there. That's why you got to be very discerning of who you're getting your information from.
Well,
That's
the
just
pellet
bottom
people
line.
are probably just, those are people that
Pellet
are
people.
only trained in pellets, right? And
Yeah.
and I think the issue you're talking about is an access issue, because I think the pellet people were trained early on from the pellet makers to do this. No, I'm not. I mean, really. And so this is like one of our first options to
Yeah.
get testosterone as women. And so a lot of people
Yeah.
have done that. So it's really more about access. But now that we have more options. We're one of them, and there are a handful of other really great telehealth companies that are providing other options for people.
One thing I was going to say is OBGYNs or gynecologists or whatever, they are prescribing creams though for people, but you have to be proactive. Like if I'll
Yeah.
say, I said to my doctor, I have low testosterone. She wasn't going to do anything. And she's like, okay, I'll give you a cream. Now, the truth is those creams, I'm going to be honest, they're like, you might as well put Nivea cream on. Like it's like the same thing. They're very like benign. They're not really going to do anything. You're not going to like jack up your lean muscle mass and like get brain acuteness from the cream. It's like a very entry level thing. That would be a beginner move, right?
Yeah. And it depends on how you absorb it. It could be great for some women.
It could be great. I'm just saying, like, why do doctors then put you on cream, but they won't prescribe an injection? That they will not do to women.
It's not true, because that's not how we operate.
Oh,
But
not you. I'm saying like I'm saying if I
Your
went to my
OBGYN.
OBGYN.
well, I just think it's a lack of education. I mean, this has become such a niche and specialized field. It would be like me going to a urologist for my knee issue when I should be going seeing an orthopedic person.
yeah.
I think there has to be a little bit of ownership in the patient's hand too.
Okay.
Like, one of the things that we say all the time is you have to own your journey. We're going to help you. We're going to guide you. We're going to make sure it's safe, but you still got to do the other work.
Yeah.
You still got to eat well. You still got to prioritize sleep, prioritize your stress. Like, you got to do the right things. The same thing happens when you're embarking on this journey to optimize your hormones. You maybe shouldn't just go to the one doctor. You should maybe go to 2 or 3 and do some research on your own and know that there's some other options.
Yeah.
I've been in this business a long time. We were talking about these pellet people. Some of these doctors might believe that is the best option for
Yeah,
their
that's
patients,
true
and that's
too.
why they're only offering it. We like to put the consumer in the driver's seat, because we know when we do that, we're going to have better outcomes. We're going to have better results, because they're owning that journey, and we're going to nudge them and help them and guide them down that pathway.
See, to me, the injection way is a better way of controlling whatever you're putting yourself. Like, it's because you got to take these injections. How often are you taking it? Like, does a testosterone like twice
We
a
usually
week?
split dose, so we do it twice a week. Yeah.
And then I would imagine, Joy, like you created this because of all the women's health issues that are become important to you. You wanted to do the same thing that Josh did on the bloke side, but for women, right?
Yeah. Yeah. I mean, I wasn't paying attention when Josh started Blokes. I was trying to just have babies. And so I was like, all right. So that's why we are basically right now we're 2 different brands, is because he started Blokes first. And then later on, I went through, a really tough 5-6 years of trying to have a family. Looking back now, I'm like, oh my God, I was so naive as to how that process was going to go. It was just much harder on me than I knew it could be.
Wow.
We had
In what ways would you say?
we had a bunch of our first baby was
miscarriages.
so traumatic for us both, because she had just a genetic fatal defect. So we were kind of forced with this horrible situation I never thought I would be in, where it's like, your baby's not going to make it. Makes me cry just to think about it. So we were basically forced to end it early. And that was one of the hardest things I've ever done.
Oh, wow.
Sorry.
Oh my God, that's horrible.
And we had to experience that, and not the trisomy, but we had to experience that 3 more times. And
There was 3 more miscarriages after that.
there was 3 more miscarriages. But I will tell you,
I'm so sorry for you.
Thank you. Yeah.
I've never seen her in probably anything more dedicated to one thing. And that time period, it was just about having babies.
Yeah.
Like, our life was literally consumed by it. And I think to some extent, because of that trauma, it was just physically and mentally really hard on our relationship.
Yeah.
Obviously, us individually. And, she was diving in and I was diving out. Right. And physically, we were both going through these crazy hormonal changes, physical changes. And it was just a gnarly experience.
Yeah.
And I can tell you from an outsider looking at her, she just got done breastfeeding our son Rowdy. And
great name.
Was like, holy shit. Now, for me, there was a little bit of vindication because she didn't have a sex drive at that point.
Yeah.
Right. I was like, yo,
hit switch.
I told you.
Yeah.
Like, it wasn't just me. I didn't think you were unattractive.
Yeah,
like,
yeah.
And she was like, oh, this is how it feels.
Now I get it.
Yeah.
I'm good. I don't need it now.
That's so, you know what, by the way, before you started taking your testosterone, like, what was your level?
Yeah, I mean, so I basically, after all of that, I was in my early 40s when I had my second child, and I felt horrible, looked horrible. I had no energy to take care of them. And that's when I was like, well, what do I do now? Because I also felt very abandoned. If you look at how many appointments and how much help I had to get pregnant, to stay pregnant, to have my babies.
Yeah, wow.
And then after that, it was like, you're good. Have a nice life. And I was like, I'm actually not good. And where do I get help? So I went through the men's side. I went through the program. I did this huge deep dive lab. I started looking at my thyroid, doing my hormones, and testosterone was one of the first therapies I got on. And it just like helped start getting me motivated, start going, working out in the gym. I felt like I was getting stronger, and that was exciting.
It's a good push in that. It's a good kick in the butt to get something started.
Yeah. Brain fog too, by the way, because I knew there was one time when I was like, there's no way I could go back to work, just with how my brain felt after kids and going through all that. I was like, I can't do a simple math equation. So it helped lift that brain fog for me, which was fantastic too.
By the way, girl, wait, because even though like it's going to happen again, like I was saying, you know, I think also like as the kids get older, your brain fog doesn't get any better. Actually, trust me, I can't do a math equation I cannot do third grade math if to save my life, honestly. And my brain fog is just.
All right, well, why don't we get you on a little bit of testosterone and see if
like I have to just bite the bullet with this testosterone because I know that it could be a real game changer with the hormones.
It very well could be. And let me tell you this, if you don't like it, then you can say it's not for me and get off it.
Exactly. Well, that's why the injections I feel are very important. By the way, I urge everybody here, and I talk about this. Funnily enough, I was posting about this today, completely coincidentally that you guys were coming on, but I think it's so important for people to get their blood panel checked like regularly because your what do you call it? Your hormone levels, everything changes all the time, and people don't know what they don't know. So people should be getting that. What do you think? Like every 4 to 6 months, people should get this stuff checked.
I think if you're not on treatments, it should be no less than twice a year, and it should be more complete panels, not just the onesies and twosies that we see so much at a primary care internal med doc.
Talk about that. What's to tell people? Because I think it's people don't know what they don't know.
I mean, I have a little bit of insider knowledge because I've been in the lab space for a long time as well.
Yeah.
And there's something called reactive based testing. And what happens is you come in, you have a symptom, the doctor goes, I'm going to test you for these 2 markers. And then you come back, you see the doctor, and then they go, you know what? It's off. We're going to test you for this marker. So you're never getting that whole picture.
Yeah.
One thing that we believe in is if we're going to treat and if we're going to diagnose, it's kind of this, test, don't guess mentality. So even our most baseline panels still coming equipped with 40 biomarkers. So we can make a really good deep dive into your health by looking at a ton of different biomarkers, asking the right questions. And that just puts you on a warpath to just get healthier.
Right.
So
what do you get with 80? Like, what are you checking for with a panel with 80 biomarkers versus 40 biomarkers?
It's just more depth, but for our 40 biomarker, we're still doing, call it light hormones.
Okay.
No major inflammatory markers, no stress markers. We're getting your CBCs, we're getting your complete metabolic panel. But as you go, we're adding thyroid, we're adding inflammation, full thyroid. We're adding inflammatory markers like C-reactive protein, cortisol. We're adding ApoB, important heart markers to really then deep dive and I say you're starting to get into that more longevity space. You're starting to get way ahead of reacting. You're getting in a very proactive state when you start adding more markers.
So talk about more than, okay, so obviously we kind of covered hormones and being on top of your health in that way, right? Like getting them checked, seeing where you're low, if you're deficient, how you could supplement for them. What else can people be looking for optimizing their health and their longevity besides just hormones? So I know you have with Joy, do you guys have this a same, like what's similar, what's different in
They're pretty similar
yeah.
panels.
Yeah.
There's a few markers here or there for between sexes, but they're very
on the
very
women's side, what's added or subtracted? Same? Because I mean, we're all in this 80 biomarkers. We're probably all checking the same stuff, correct?
Yeah,
It's-
I mean the prostate for guys.
Yeah, there's a
we test-
PSA.
Oh, yeah.
That kind of
That's
thing.
really it.
Yeah.
I mean,
Well, that's a big one though, isn't it?
yeah, no, totally. And you know, they're what I will tell you is very similar approach. This is a human thing. This isn't a male female thing.
I was going to say this is a yeah.
And the reality is we just analyze markers differently depending on the male or the female.
Right, right.
And some have more of an emphasis. Like testosterone levels for a female is going to be completely different than an optimal range for a man.
Right.
The same with progesterone, the same with estrogen. You know, but there's some universal markers that you just want to be in a healthy range, you know, like A1C and C-reactive protein.
Right.
And it's an art and it's a science.
So okay, so walk me through this. So people get their 80 biomarkers checked, and then they, you know, the nurse goes home. Then you guys put together a very preventative, proactive plan for the person. What else is there besides like testosterone, peptides? What else is provided as options? Supplements, like what kind of supplement, like how else are you guys optimizing people's health?
You want me to go? I mean, yeah.
Sure.
One of the things that was important.
Oh, by the way, besides the estrogen cream, we're going to get to that face cream in a second.
Yeah.
It's a real treat for you ladies and men.
I think one of the things that was very important for us as a company was to create an ecosystem for everyone.
Mm-hmm.
I think that labs are the foundation to creating a healthier life. It's just such a great deep dive into your health at what's going on at that time. And outside of the hormones, outside of the peptides, outside of the GLP-1 agonists, we've developed this algorithm called Smart Supplements, where we're taking your biomarkers, and you'll see this as you evolve in our process, but we're going to address your supplements through your deficiencies. We're gonna give you a supplement pack that's solely designed for your nutrition and biomarker deficiencies that are going to be very precise in how they're actually addressing your issues. Beautiful thing about it, comes in a nice pack, has your name on it, so it's extremely personalized. So I like to, you know, I've always had a love-hate relationship with the supplement space just because it's always been the wild, wild west coming from medical. And this was our way of saying, you know what, if we're going to treat you, we're going to treat you with precision when it comes to supplementation.
So what kind of supplements are the options? Like what are the things that when you've noticed now that people are usually very deficient in?
Probably the most common is vitamin D.
Vitamin D.
Still vitamin
Oh my
D.
God.
Yeah.
You
I don't
know,
think we're getting the sun that we used to. Vitamin D is a huge one.
Is it because people are wearing sunscreen as well?
Sunscreen, sunglasses, covering up. I think so. Yeah.
I think-
We're inside always.
Yeah.
Yeah.
And
that's
there's
true.
things that lower it, you know, like there's women are on birth control pill for decades, and there's medications, antibiotics, and all that kind of stuff can lower your vitamins and minerals. Staring at your phone constantly has, you know, there's all kinds of, you know, things that kind of mess with our natural, you know, production of vitamin D and all that, you know, all the vitamins.
Yeah, I think, you know, and then there's a whole slew, but that's the one that, you know, we found some research that says like 40% of Americans, what we see coming in our clinic is probably closer to 90% of people are deficient. I'm deficient. I'm getting on a prescription version of vitamin D.
Really?
Yeah. I just, I had a clinical consult before I came here, and they're like, dude, this is just, it's ongoing. Like, you got to treat it. And I've been treating it with supplements, but now I'm going to get on a prescription version of it that's a little stronger, and it's a once a week capsule versus daily. And hopefully it improves.
Really?
Yep.
So you guys can you guys give that type of prescription for? Wow, vitamin
Sure.
D. Okay, what other? Give me some other supplements that you. What do you think of this idea of what do you call it when supplements are? There's a specific word for it. Methylated.
Methylated.
Yeah, methylated supplements. Do you know what this is?
Yep.
Yeah, I mean, I think there's something like 40% of people have that MTFHR gene
Yeah.
mutation. So it's harder for them to metabolize some of those supplements. So if you give them the methylated version, then it's better for them to be able to actually use it.
It's really B12 that is the primary focus on that one.
It's B12.
Yeah.
And then, how do you know if someone needs methylated?
Got to get a test for it.
Yeah. Do you guys test for that too?
There's a genetic test for it.
Yeah,
but
genetic testing.
Correct. Yeah. I mean, we have not brought out genetic testing. We've been slow on it. It's a crowded space. I think it's a great way to look under the hood. And
Yeah.
I've done genetic testing on myself, and I think there's merit to it. But to truly optimize, I think you really need to focus on your blood work.
Yeah. That's what. Yeah. Okay. Other supplements besides. That's my kid. I don't know if you can hear that.
Two of them. Guilty.
Yeah, I mean, today was the last day of school, so I mean, I'm shocked that it's been as quiet as it is
Yeah,
now.
they're great.
Actually, I mean, it's called an iPad. No, I but no. I said 30 minutes. I'm very strict about this, but okay. So let's get back to this. So vitamin D. What else would you say are other things that like are you because that estrogen cream I'm serious like it does like change the texture of your face looks amazing. I know you have great genetics, but can you tell people about this cream? Because I'm telling you, I want this cream. I'm
Yes.
not being paid to say this, guys. I swear.
I am going to send you this cream because I honestly really do believe in it. We've come out with this. It has a couple of different like power ingredients.
Okay.
One is GHK copper peptide, and that's very regenerative for your cellular turnover. You know, people use it actually on like scars and stretch marks. It's that healing. And then it also contains estrogen, and it's estriol is the form of estrogen that it contains, because we know estrogen really helps with our collagen production. A crazy stat is that women lose something like, 30% of their skin firmness in the first 5 years of menopause because of that loss of
Elasticity.
estrogen. Yeah, so it contains those two things and then a couple other little vitamins in there. And there was 1 month where I had 3 random people, not, of different patients and friends, text me and say that it's time for my Botox and I don't need it. Like it's extended my time in between.
Really?
Botox. So I love it. That's the only thing that I really use, and will always use it. And I'm going to send it to you.
No, it's amazing. So then you supplement. So vitamin D. What was you said. How about omega 3s? How about
that's in there.
all the basics?
Yeah,
Besides the basics, though, what else can you supplement that people could be deficient in?
I mean, so the formulary that is coming from the smart supplements is somewhere around 45 different supplements. And there's the basics. And then you can get ashwagandha, tangana-li, DHEA, all kinds of different things. Yeah. And really the beauty is we're not driving the ship. Like we have a software that helps us drive it. And then we look at the biomarkers and we say, oh, your DHE is low. Well, that's what we should be supplementing with. The reality is people are coming with more than we can even put in that pill pack. So you just start with the most important.
Yeah.
But it's really interesting because I told you I had a love-hate relationship with supplementation. We have seen firsthand changes of people who are not ready to get in the hormones, not ready to get in the peptides. We have an influencer who works with us. His name's Cold Plunge Cam. And he's been very honest and open.
What's his name?
His IG name is
IG name. Yeah, his name's Cam LeVar.
What's his name? No, what's his name?
Cold Plunge Cam.
Cold Plunge Cam.
Yeah.
Is that the same one you saw? Okay. Yeah. Okay. I think I saw it today, actually.
So it's remarkable. So I tell this because he was like the awakening for me with this, because he's like, I'm not ready for that. I'm still in my 30s, but I am going through some really, really gnarly mental health issues. And he's been dealing with this for his whole life, honestly. And I think there was a lot of issues in as a child in terms of his diagnosis that he's realizing, and he's trying to address it naturally. And he's trying to get off of SSRI. So I got a text from him on, I think, Sunday. He's like, he just randomly said, "Hey, dude, thank you. Thank you for encouraging me to get blood work. Thank you for encouraging me to address this with supplementation." And he's now officially off all his medications.
Really? Just by
Yes.
supplementing?
That and obviously cold plunging and you know, lifestyle adjustments. But
He's worked very hard. You can follow his journey because he obviously advises like no one to just get off him.
no, it's been a journey.
It's a huge journey, and he works very hard at it.
But it's the first time, you know, his words, and I'll kind of paraphrase it, but he was in the driver's seat. He was pushing back on his doctors and saying, no, I want to go this route. It's time.
Yeah.
And I have help. I'm looking at my biomarkers differently. It was funny. He went to his parents and he's like, "Oh my God, my DHEA is so bad." And you can address that easily through supplementation. And he went to his parents and his parents like, "Yeah, we've always had low DHEA." And he's like, hello? Like,
Yeah.
I've been struggling with mental health issues my whole life. And you haven't told me like some of the things that genetically could improve just by
Yeah.
supplementation. So the power of that is powerful. Like precise supplementation is extremely powerful.
Yeah, no, I totally agree with that. Because I guess, again, I keep on saying this, but people just don't know what they don't know. And if they haven't been taught to take these things more seriously, they just think it's not that important, right? And so I think that the idea of being preventative is so important for people. And also, like you said earlier, like be your own boss, like take initiative. Don't just rely on what someone tells you.
Right.
Like you have to be your own advocate, especially like unfortunately, especially in America, like the healthcare system here is very broken, very broken. And a lot of people are very sick and are unable to have proper care. It just is what it is.
It's tough.
It's so complicated. And also it's so complicated.
Yeah.
Really, our system is set up. There's a lot of good about the system, and it's set up.
Where? Because honestly, I don't know where.
And I love that you're saying that.
I think it's a known thing, isn't it? Like
It is a known thing. I'll tell you, well, I saw a Harris study recently that said 70% of Americans think the healthcare system has failed them. So it's a very real thing. But what they're good at is emergency medicine. You got a broken bone. You need
Right.
a surgery.
urgent care.
You have a diagnosis. You want treatment. Like, so it's something has happened. You want them there.
You just said it right there. If something has happened already.
Yeah.
But not if something has not happened and you
Yes.
want to be on top of your shit. That's the problem.
And that's what we're
know?
trying to fix.
Yeah.
We're trying to be before that something happens.
Yeah.
And I also think it's, obviously it's not just us. There's a huge, new boom of like the at-home things and the customers that are giving you data. Like all that data tells you something and gives you options of what to do. Like now you're informed. The next step is you take care of it.
Yeah. Well, you need to have, you have to like take initiative and execute on it. Like one thing is
Yeah.
knowledge, but then if you have knowledge and don't do anything about it, what good is it for you, right? That's the bottom line. You have
Yeah.
to do something with that knowledge.
Yeah.
There's a lot of people who are aware and they don't want to take that initiative.
Right.
And I think just taking the first step in this journey can be pretty powerful. And especially, I think one of the things that people are misinterpreting or not understanding about, the GLP-1 category, Ozempic, Mounjaro,
Yeah.
is for the first time, these people are all of a sudden getting a little bit of confidence and pep in their step about their diet and about their lifestyle and about having, like I told you, that food freedom that they haven't had in years. I mean, if you've been obese for 10 years or more, or even a year, that's been a chronic condition that has been ingrained in your lifestyle.
Yeah.
That is hard. And if all of a sudden you got this little cheat code, doesn't mean it's going to get you all the way there. You
Yeah.
still got to play the game. But if you got that little cheat code, all of a sudden you have just a little edge to live a healthier life.
I also think that it gives you a little hope. Right?
Yes.
And hope can take you very far in life, right?
Yeah.
Very, very far. And if you see, like I always talk about this, that if you actually just see a glimmer that something can be different and hope, that can take you further than anything else, right? So if they see themselves getting a little bit stronger or like a little bit like a little bit like lighter, it will maybe put something in their head like they want to continue. It will
Absolutely.
it will help them do the next move, which is why I think it could be a huge game changer. And it quiets your brain from all the things. Like you and I, Katie, were talking this last night. Like I said, we said that I'm not to talk about this ad nauseum, but like it's one thing to take. Anybody can like OD on something or take too much, right? Because this idea is more, right? But if someone just like uses it properly,
Right.
I think that there could be a lot of advantages for it, really, right? But you have to
There
know.
is. Yeah.
And I think it's important for people to know that like be very conscientious, do your research. Know that like you should be very discerning who you trust. Like do your research. Know who the good ones are, who the bad ones are. Talk to your friends. And find out, because there's so much information on Instagram now and TikTok. That's where people are getting their information from. Right. So like know who the influencers, like the people that you're looking at, like what are their, like, like who they are.
Yeah.
I think that makes a big difference.
I will tell you, when we are doing a GLP-1 for someone, we'll have monthly follow-ups with a coach. So we'll pair someone with them so that they do a virtual call, they check in, say, how are you doing? And, that's where we guide them on like, you need to eat. If you're not eating, we need to lower your dose. If you're having any side effects, we lower your dose. And if you're doing great, you don't always need to increase it. If you're doing great, just stay there because it's slow and steady.
I was going to say, does your body acclimate to this stuff? Like, do you have to increase it eventually, or does your body just like?
It really depends on the case.
Oh, yeah?
You can. If you have like a ton of weight to lose, then probably you're going to be titrating up.
Yeah.
But if you don't and you're like slowly losing, then there's no need to like up the dose.
What if you're not losing, you're just maintaining, or like on the semaglutide? This is just like a side question. What would happen if you're staying on the same dose? Does your appetite just like come back slowly and you start gaining weight again because your body now is so adapted to that amount?
No, I think, so peptides in general are very regenerative.
Okay.
And so
Right, you called it a peptide before. Right? I called it a weight loss drug, or a weight loss.
It's in the category.
Yeah, it's called all of those things.
Yeah.
But so the point of it is helping with your metabolic health. And so that's also why you drill in. It's so important for the protein and the lifting weights to keep that muscle, so that when you titrate down or get off it, that your muscle is there to then keep you, processing your food and burning your fuel.
Yeah, and the hope, like I said earlier, like it allows you that food freedom to create better habits.
Yeah.
And imagine your body and mind on a 6-month journey of something where you've started creating that stuff. The momentum is with you. And
exactly. Everything in life is momentum.
Your husband and I talked about, I think we are a company that provides momentum.
Yeah,
I truly do.
I by the way, that's exactly what I was just going to say. My husband talked to you about this?
Yeah, we talked last night.
About this?
We were just talking about the power of momentum.
Yes.
And
you stole my line. Just kidding.
We talked about a lot last night.
I know, I'm just teasing.
But I truly believe that in health. Like if you've
agree.
been unhealthy and all of a sudden you get a taste of like feeling good.
Totally agree.
How powerful is that?
That's why I think that these things, it's the most powerful thing. That's why it's like, I think, again, hope, like anything that gets you to a place of action where there's momentum, because nothing happens with no momentum, like inertia. It's very, very, very important. My whole life is based around momentum. So that's why I could not agree with you more. These chairs, by the way, are so uncomfortable.
I'm actually enjoying them.
Oh my God, I'm so uncomfortable. We're going to have to wrap this podcast. My God. Okay, Josh, Katie, Blokes, Joi, Blokes. You guys are so great. I'm so glad I got to meet you guys.
Us too.
And you guys are awesome. And everyone, go get labs. It's very important for your health, your preventative care, just where you are. You can't, health is wealth. And like, if you don't have your health, you have nothing. You can't do anything. You can't be there for your kids, your family, your work. Like, to me, it's it's something that is so overlooked and so under indexed, but the most important thing that we have.
Right.
It's unbelievable.
Yeah.
So-
I'm so glad we met you and your husband.
Thank you.
We have been on cloud nine after that dinner. And it was so much fun. It was a great
we
time.
feel the same way about you guys. That's why
Yeah.
I'm so glad that we just got to do this podcast on these uncomfortable chairs. But thank you. And what's your it's called your IG, or give everyone like the.
Yeah, Joy is spelled Joi, by the way. And on Instagram, we're Joy Women's Wellness. And then our website is choosejoy.co.
Blokes is at Get Blokes, Blookes. My daughter always makes fun of me when I say that. And then blokes.co. Super simple.
I love it. Thank you guys.
Thank you.